Hi, good morning Shannon. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of July 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Shannon Wayne.
And what is your candidate number?
My candidate number is 272302723.
Okay. Are you taking this test as a nurse?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What inspired you to become a nurse?
I was inspired to become a nurse by my grandmother, who was a nurse herself. She always told me stories about how she cared for her patients, and how rewarding it was to see them recover and smile. She also taught me the values of compassion, empathy, and service, which I admired and wanted to emulate. I decided to pursue nursing as a career because I wanted to make a positive difference in people's lives and health, just like my grandmother did.
What are some common challenges that nurses face?
Nurses encounter various difficulties in their work, such as having too many patients and tasks, receiving low salaries and recognition, facing hazards and risks, not being able to rest or call in sick, not being listened to or respected, and dealing with different and challenging patient situations. We need to find ways to cope with these difficulties, such as reducing stress, expressing their needs and opinions, standing up for their rights and interests, getting help and advice from others, and improving their skills and knowledge.
What are some common misconceptions about nursing?
Nursing is a profession that suffers from many stereotypes and myths that do not reflect the reality and complexity of the work that nurses do. Some people think that nursing is only for women, that nurses just obey what doctors tell them, that nurses are selfless and angelic, that nurses are not smart or capable enough to be doctors, or that nurses only perform simple and dirty tasks. These misconceptions are not only inaccurate, but also disrespectful and harmful, as they undermine the diversity, autonomy, professionalism, compassion, intelligence, and skills of nurses. Nurses are a vital part of the healthcare system, and they deserve recognition and appreciation for their contributions.
Can you tell me some interesting facts about nursing?
Nursing is a profession that dates back to ancient times, but was modernized by Florence Nightingale, who introduced scientific and sanitary practices to nursing. Nurses can pursue different levels of education, including doctoral degrees in nursing, which allow them to conduct research, teach, or practice at an advanced level. Nurses also have different specialties and roles, such as critical care, pediatrics, oncology, education, administration, etc. Nurses walk a lot during their shifts, averaging 4 to 5 miles per 12-hour shift.
How can we support and appreciate nurses more?
We can support and appreciate nurses more by doing things like advocating for their safety and well-being, expressing our gratitude and recognition, donating what we can, respecting their rules and requests, and offering practical help or emotional support. For instance, I recently contacted my representative and urged them to pass legislation that supports nurses' needs and rights. I think these actions can make a difference in showing our appreciation for nurses and their work.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-play card, if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning. I'm Nurse Shannon Wayne, and I'm here to help you. What brings you to the hospital today?
Good morning, Nurse Shannon. I'm here because I have been having these terrible skin rashes for the past few weeks. They are very itchy and red, and they appear all over my body.
I'm sorry to hear that. Well, before proceeding, could you please tell me your name and age for the documentation?
Yes, my name is Mihiraa. I am 35 years old.
Thank you for the details. Mihiraa, it would be great if you could briefly describe your condition in your own words.
Sure, nurse, I will. They occur almost every day, sometimes more than once. They usually last for a few hours and then disappear. But they leave marks on my skin.
Oh, I see. How do the rashes look and feel?
They look like raised bumps or welts, sometimes with blisters. They feel very hot and swollen, and they make me scratch a lot.
I can understand how hard it might be for you. If you don't mind, for more insight into your condition, I would like to ask you for a few more details.
Why not? You may please go ahead.
Thank you for your permission, Mihiraa. Do you have any other symptoms, such as fever, headache, nausea, etc.?
No, I don't have any other symptoms. Just the rashes.
All right. Do you have any idea what causes the rashes?
No, I don't. I haven't changed anything in my diet or lifestyle recently. I don't know what I'm allergic to.
Okay, for confirmation, let me summarize what you have told me so far. You have been having these terrible skin rashes for the past few weeks. They are very itchy and red, and they appear all over your body. They occur almost every day, sometimes more than once. They usually last for a few hours, and then disappear, but they leave marks on your skin. They look like raised bumps or welts, sometimes with blisters. They feel very hot and swollen, and they make you scratch a lot. You don't have any other symptoms, such as fever, headache, nausea, etc. You don't know what causes the rashes, and you haven't changed anything in your diet or lifestyle recently. Is that correct?
Yes, that's correct.
Thank you for confirming, Mihiraa. I appreciate your cooperation and patience. Based on your description, it sounds like you might have a condition called urticaria or hives. It is a type of allergic reaction that affects the skin. It can be triggered by many things, such as food, medication, insect bites, stress, etc. Sometimes the cause is unknown. Do you have any questions for me so far?
Urticaria. Is that something serious?
Well, don't panic, Mihiraa. Urticaria is a common skin reaction that occurs when your immune system overreacts to something that it considers harmful.
So you mean I could be allergic to anything?
Well, not exactly. Some people are more prone to urticaria than others, and some triggers are more common than others. For example, some of the most common allergens are nuts, eggs, shellfish, strawberries, penicillin, aspirin, latex, etc. First of all, we have to find out the reason behind it.
How can I find out what I'm allergic to?
Your question is valid. Mihiraa, some tests can help identify your allergens, such as skin prick tests or blood tests. However, these tests are not always accurate or available. Sometimes, the best way to find out is by keeping a diary of what you eat and do, and when the rashes occur.
I see. That is more practical. Definitely, I will do as you said. By the way, how can I get rid of the rashes?
Mihiraa, I will explain some of the ways to get rid of the rashes. Some treatments can help reduce the symptoms and frequency of urticaria. The most common ones are antihistamines, which block the action of histamine, the chemical that causes rashes. Antihistamines can be taken orally or applied topically. Apart from this, there exist corticosteroids, which reduce inflammation and swelling, and immunotherapy to enhance immunity.
Okay. Do they work well?
Yes, they work well for most people, but some may have side effects, such as drowsiness, dry mouth, etc. You should follow the instructions on the label, or consult your doctor before taking any treatment.
All right. Which one is best for me?
Mihiraa, your concern is natural. However, I am not the authorized person to provide such information. That depends on your condition and your medical history. You will need to see a dermatologist or an allergist for a proper diagnosis and treatment plan.
Okay, I got it. And what can I do to prevent or reduce the rashes in the future?
The best way to prevent or reduce urticaria is to avoid your known allergens as much as possible. You should also wear loose clothing that does not irritate your skin, apply cool compresses or calamine lotion to soothe your skin, and avoid scratching or rubbing your skin.
All right. Is there anything else I should know?
Yes. It would be great if you know when to seek medical attention. Mihiraa, you should see a doctor if your symptoms worsen or do not improve with home remedies. You should seek medical attention if you have difficulty breathing or swallowing, if you have swelling of your face, lips, or tongue, if you have signs of infection, such as pus or fever, or if you have severe pain or bleeding.
Okay. Thank you very much for your help, Nurse Shannon.
You're very welcome. I hope you feel better soon. If you have any more questions or concerns, please feel free to contact us anytime.
Thank you very much, Nurse Shannon. Have a nice day.
You too, Mihiraa. Take care.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.